Section 3. Disorders of the Elderly. 1. A vast majority of Americans survive to at least age blank. A. 45, B. 50, C. 55, D. 65. The correct answer is D. 65. 2. All of the following are psychiatric disorders common among older adults except A. Anxiety, B. Attention deficit hyperactivity disorder, C. Depression, D. Dementia. The correct answer is B. Attention deficit hyperactivity disorder. 3. Which of the following is a barrier to treatment of psychiatric disorders among adults? A. Many people believe that depression is part of the natural conditions of aging. B. Many adults are reluctant to discuss psychological symptoms. C. Treatment of mental disorder in older adults can be complex. D. All of the above. The correct answer is D. All of the above. 4. Almost 1 in blank persons age 85 or older experiences severe symptoms of depression. A. 4, B. 5, C. 6, D. 7. The correct answer is A. 4. 5. Older adults have the blank suicide rate in the United States. A. Highest, B. Second highest, 3. Third highest, D. Fourth highest. The correct answer is A. Highest. 6. Blank addresses the unique mental health care needs of elderly patients. A. Gerontologic nursing, B. Geropsychiatric nursing, C. Medical surgical nursing, D. Community health nursing. The correct answer is B. Geropsychiatric nursing. 7. Which of the following can work as a typical case manager? A. Geropsychiatric nurse, B. Pathophysiological nurse, C. Psychopharmacological nurse, D. All of the above. The correct answer is A. Geropsychiatric nurse. 8. The geropsychiatric nurse must have thorough knowledge of which of the following? A. Pathophysiology, B. Psychopharmacology, D. Normal aging process, D. All of the above. The correct answer is D. All of the above. 9. Blank APNs combine strong background in medical surgical nursing and psychiatric nursing with patient education. A. Geriatric, B. Geropsychiatric, C. Geropsychologist, D. All of the above. The correct answer is B. Geropsychiatric. 10. APNs may be more capable than other healthcare professionals in meeting the needs of older adults because blank. A. They are more friendly. B. They are more qualified. C. They are more accessible. D. All of the above. The correct answer is C. They are more accessible. 11. Blank provides behavioral health care for elderly adults with mental disorders. A. Geropsychologist, B. Geropsychiatrist, C. Geriatric APN, D. Community health nurse. The correct answer is A. Geropsychologist. 12. Blank are medical doctors with advanced training in assessing and treating mental disorders and related medical problems in older adults. A. Geropsychologist, B. Geropsychiatrist, C. Geriatric APN, D. Community health nurse. The correct answer is B. Geropsychiatrist. 11. The geropsychiatrist is expected to have knowledge of blank. A. Psychopharmacology. B. Biological determinants of mental impairment. C. Age and gender-related changes in physiology. D. All of the above. The correct answer is D. All of the above. 14. Normal aging brings which of the following changes in mental functioning? A. Decline in intelligence. B. Decline in learning ability. C. Decline in reaction time. D. All of the above. The correct answer is D. All of the above. 15. The decline in mental functioning becomes more significant by about age blank. A. 65. B. 75. C. 85. D. 90. The correct answer is B. 75. 16. Which of the following changes occur in the brain with age? A. 20% decrease in the brain's weight by age 90. B. Selective loss of 10% of neurons. C. 30% decline in synapse. D. All of the above. The correct answer is A. 20% decrease in the brain's weight by age 90. 17. Which of the following is true about the aging brain? A. Intellectual functioning remains stable. B. Many older adults remain inflexible in behavior. C. Many older adults remain inflexible in attitude. D. All of the above. The correct answer is A. Intellectual functioning remains stable. 18. Which of the following is true about cognitive changes in older adults? A. Older brains are more organized. B. Older adults use less of their brains. C. Cognitive capacity declines. D. All of the above. The correct answer is C. Cognitive capacity declines. 19. Which of the following is true about memory and manipulation? A. Mental processing grows more efficient with age. B. World knowledge gained through experiences remain intact. C. Accumulated world knowledge decreases. D. None of the above. The correct answer is B. World knowledge gained through experiences remain intact. 20. Which of the following is a possible cause of cognitive disorder? A. Disease. B. The brain's response to a systematic disturbance. C. Reaction to toxic substance. D. All of the above. The correct answer is D. All of the above. 21. Blank manifests clinically as mental deficits in patients who previously didn't show such deficits. A. Cognitive disorders. B. Cognitive functioning. C. Cognitive relapse. D. Cognitive reformation. The correct answer is A. Cognitive disorders. 22. Blank is a prominent feature of many mental and physical disorders seen in adults. A. Cognitive functioning. B. Cognitive relapse. C. Cognitive deficit. D. Cognitive reformation. The correct answer is C. Cognitive deficit. 23. All of the following are ways to aid memory retention except A. Giving full and total detail. B. Using pictures. C. Choose text that explicitly represents material. D. Avoid instructions that require more mental processing. The correct answer is A. Giving full and total detail. 24. A person's vocabulary increases slightly until about age blank and then starts to decline. A. 90. B. 80. C. 85. D. 75. The correct answer is D, 75. 25. Blank is the ability to solve novel problems. A. Cognitive reformation. B. Fluid intelligence. C. Mental processing capacity. D. Cognitive deficit. The correct answer is B. Fluid intelligence. 26. Blank is the ability to understand text, make inferences, and pay attention. A. Fluid intelligence. B. Cognitive reformation. C. Mental processing capacity. D. None of the above. The correct answer is C. Mental processing capacity. 27. All of the following decreases with age except A. Fluid intelligence. B. Mental processing capacity. C. Brain's weight. D. Intellectual functioning. The correct answer is D. Intellectual functioning. 28. All of the following are cognitive process minimally affected by aging, except A. Working memory. B. Implicit memory. C. Prospective memory. D. Picture recognition. The correct answer is A. Working memory. 29. Blank is used for tasks such as keeping a phone number in mind just long enough to write it down. A. Implicit memory. B. Working memory. C. Prospective memory. D. None of the above. The correct answer is B. Working memory. 30. Blank is responsible for storing information on a relatively permanent basis. A. Working memory. B. Prospective memory. C. Long-term memory. D. Implicit memory. The correct answer is C. Long-term memory. 31. High cognitive performance in older adults depends on which of the following? A. Educational level. B. Activity level. C. Peak pulmonary flow rate. D. All of the above. The correct answer is D. All of the above. 32. Which of the following is an important risk factor for depression in older adults? A. Death of loved ones. B. Low self-esteem. C. Low social status. D. Fear. The correct answer is A. Death of loved ones. 33. Blank is the natural response to a loved one's death. A. Insomnia. B. Loss of appetite. C. Bereavement. D. Anxiety. The correct answer is C. Bereavement. 34. All of the following are red flags of bereavement, except A. Frequent thoughts of death. B. Constant fidgeting. C. Sense of worthlessness. D. All of the above. The correct answer is B. Constant fidgeting. 35. Blank refers to a sequence of mood changes that occurs in response to an actual or perceived loss. A. Mood swings. B. Bereavement. C. Grief. D. Depression. The correct answer is C. Grief. 36. Acute grief usually lasts up to blank. A. 1 week. B. 1 month. C. 1 year. D. 13 years. The correct answer is C. 1 year. 37. Which of the following is a stage of grieving? A. Disequilibrium. B. Reinvention. C. Relapse stage. D. Revive stage. The correct answer is A. Disequilibrium. 38. In the blank stage of grieving, the patient typically experiences loss of self-esteem. A. Relapse stage. B. Disequilibrium. C. Reorganization. D. Disorganization. The correct answer is D. Disorganization. 39. In the blank stage, the patient establishes new goals and interpersonal relationships. A. Revive. B. Reorganization. C. Equilibrium. D. None of the above. The correct answer is B. Reorganization. 40. Which of the following is a sign of pathologic grief reaction? A. Psychosomatic illness. B. Extreme hostility. C. Wooden or formal conduct. D. All of the above. The correct answer is D. All of the above. 41. All of the following are steps to help a patient cope with grief, except A. Establish a rapport and build trust. C. Encourage him to express sadness or anger. C. Help patients establish a regular daily routine. D. Help him determine what realistic changes he needs to make. The correct answer is C. Help patients establish a regular daily routine. 42. Which of the following is true about assessing and diagnosing depression in elderly patients? A. Diagnosing disorder in elderly patients are challenging. B. Older patients are likely to report psychological symptoms than any other symptom. C. Coexisting medical disorders are more common in younger than older patients. D. Mental disorders can be differentiated clearly from non-pathologic types of age-related cognitive decline. The correct answer is A. Diagnosing disorder in elderly patients are challenging. 43. Which of the following is not true about the treatment of psychiatric disorder in elderly people? A. Treatment may include support groups. B. Multidisciplinary team approach may be used. C. The team may include a dietitian. D. Referral should not be made early in the treatment process. The correct answer is D. Referral should not be made early in the treatment process. 44. Blank gives adults the chance to discuss how their illness affects their lives. A. Outpatient therapy. B. Support groups. C. Counseling. D. All of the above. The correct answer is B. Support groups. 45. In many hospitals, the work of the blank is to aid rapid expert assessment and interventions. A. Nurse. B. Social worker. C. Liaison psychiatric intervention. D. Psychiatrist. The correct answer is C. Liaison psychiatric intervention. 46. Blank elderly patients are at much greater risk for falls. A. Agitated. B. Depressed. C. Relaxed. D. All of the above. The correct answer is A. Agitated. 47. When providing care in a patient's home, you'll need to be thoroughly familiar with which of the following? A. Physical assessment techniques. B. Crisis de-escalation. C. Community service. D. All of the above. The correct answer is D. All of the above. 48. Which of the following is not a requirement of OBRA, Omnibus Budget Reconciliation Act? A. Mandates the monitoring of physical restraints in skilled nursing facilities. B. Mandates the monitoring of chemical restraints in skilled nursing facilities. C. New residents may be screened depending on mental situations before admission. D. Skilled nursing facilities should have professional mental health consultants. The correct answer is C. New residents may be screened depending on mental situations before admission. 49. A geriatric patient with a history of acting out behavior needs a thorough physical assessment with baseline diagnostic tests, including which of the following? A. Electrocardiography. B. Complete blood count with differential. C. Chemistry panel. D. All of the above. The correct answer is D. All of the above. 50. Intervention should aim to provide all of the following, except A. Keep the patient from harming himself or others. B. Provide rapid sedation. C. Teach him appropriate ways of behaving. D. Avoid over-medication. The correct answer is C. Teach him appropriate ways of behaving. 51. Blank are used to evaluate patients for suspected dementia and to stabilize aggressive patients. A. Inpatient geropsychiatric units. B. Hospital emergency departments. C. Long-term care facilities. D. None of the above. The correct answer is A. Inpatient geropsychiatric units. 52. Blank provides intense, structured, multidisciplinary therapy for patients who have more acute needs than outpatients. A. Hospital emergency departments. B. Long-term care facilities. C. Partial hospitalization. D. Inpatient geropsychiatric units. The correct answer is C. Partial hospitalization. 53. In a partial hospitalization program, nursing care focuses on which of the following? A. Stabilizing lifestyle changes to help the patient stay well. B. Preparing the patient and his family to adapt to living with mental illness. C. Teach patients how to manage stress. D. All of the above. The correct answer is D. All of the above. 54. Blank is a practice whereby older adults take concurrent multiple medication for coexisting illness. A. Drug therapy. B. Polypharmacy. C. Outpatient therapy. D. Medication therapy. The correct answer is B. Polypharmacy. 55. Blank causes involuntary jerky movements of the face, tongue, and jaws. A. Motor disorder. B. Involuntary movement disorder. C. Medical disorder. D. All of the above. The correct answer is A. Motor disorder. 56. Generally, dosages for older adults should start at blank of the amounts used by younger adults. A. 10%. B. 15%. C. 20%. D. 25%. The correct answer is D. 25%. 57. Which of the following is a challenge to drug compliance by elderly patients? A. A large number of doses. B. Poor doctor-to-patient relationship. C. Misreading instructions. D. All of the above. The correct answer is D. All of the above. 58. There are blank prerequisites for diagnosing tardive dyskinesia. A2, B3, C4, D5. The correct answer is B3. 59. St. John's wort is known for treating which of the following? A. Depression. B. Anxiety. C. Schizophrenia. D. Tourette syndrome. The correct answer is A. Depression. 60. Which of the following is true about St. John's wort? A. Can be obtained without prescription. B. It's available as a tea. C. It's available as oil extract. D. All of the above. The correct answer is D. All of the above. 61. Which of the following is not true about administering psychotropic drugs to elderly patients? A. Psychotropic drugs may cause over-sedation. B. All patients respond to psychotropic drugs immediately. C. Drug accumulation may occur through caregivers. D. Drugs take longer to excrete. The correct answer is B. All patients respond to psychotropic drugs immediately. 62. Blank is the process used to detect toxicity in the blood or urine. A. Toxicity scaling. B. Toxicology screening. B. Toxicity identification system. D. Toxic condensed scaling. The correct answer is B. Toxicology screening. 63. Blank refers to an objectively identified decrease in cognitive functioning related to aging that's within normal limits and not attributable to a specific mental disorder. A. Age-related cognitive decline. B. Natural age cognitive decline. C. Expected age cognitive decline. D. None of the above. The correct answer is A. Age-related cognitive decline. 64. ARCD, age-related cognitive decline, is characterized by which of the following? A. Deterioration in memory. B. Deterioration in concentration. C. Deterioration in language use. D. All of the above. The correct answer is D. All of the above. 65. All of the following are signs and symptoms of ARCD, age-related cognitive decline, except A. Inappropriate dressing. B. Aggressiveness. C. Weight loss. D. All of the above. The correct answer is B. Aggressiveness. 66. Which of the following are risk factors for ARCD, age-related cognitive decline? A. Female gender. B. History of myocardial infarction. C. Heart failure. D. All of the above. The correct answer is D. All of the above. 67. The diagnosis of ARCD, age-related cognitive decline, should only be considered when which of the following has been eliminated as the cause of cognitive impairment? A. Mental disorders. B. Physical disabilities. C. Abnormal movements. D. All of the above. The correct answer is A. Mental disorders. 68. Blank is marked by global progressive impairment of cognitive functioning and personality. A. Age-related cognitive decline. B. Depression. C. Alzheimer's type dementia. D. None of the above. The correct answer is C. Alzheimer's type dementia. 69. Which of the following is true about dementia? A. Dementia is reversible if diagnosed early. B. Vascular dementia isn't as serious a health problem as Alzheimer's disease. C. Dementia causes rapid loss of language skills. D. As dementia progresses, most patients find it difficult to express themselves. The correct answer is D. As dementia progresses, most patients find it difficult to express themselves. 70. Blank are the damaged remains of microtubules. A. Neurofibrillary tangles. B. Beta amyloid. C. Apolipoprotein E. D. Aphasia. The correct answer is A. Neurofibrillary tangles. 71. Beta amyloid accumulates and forms sticky patches called blank. A. Nerve cell fibers. B. Tau protein. C. Neuritic plaques. D. Neurofibrillary tangle. The correct answer is C. Neuritic plaques. 72. Blank is a support structure that permits nutrients to flow through neurons. A. Nerve cell fibers. B. Microtubules. C. Neurofibrillary tangle. D. Neuritic plaques. The correct answer is B. Microtubules. 73. Blank is a plasma protein involved in cholesterol transport. A. Apolipoprotein E. B. Tau protein. C. Beta amyloid. D. None of the above. The correct answer is A. A polyprotein E. 74. Which of the following is true about oxidation? A. Lack of oxidation triggers the activity of immune factors to repair injuries. B. When oxidants are underproduced, they can cause damage to cells and tissues. C. It plays a part in coronary disease and cancer. D. All of the above. The correct answer is C. It plays a part in coronary disease and cancer. 75. Signs and symptoms of Alzheimer's disease occur in blank stages. A2, B3, C4, D5. The correct answer is B3. 76. Which of the following relates to symptoms in stage 1 of Alzheimer's disease? A. Bowel and bladder incontinence. B. Continuous repetitive behaviors. C. Sleep disturbances. D. Tantrums. The correct answer is C. Sleep disturbances. 77. Which of the following relates to stage 2 of Alzheimer's disease? A. Socially unacceptable behaviors. B. Depression. C. Deterioration in personal appearance. D. All of the above. The correct answer is A. Socially unacceptable behaviors. 78. Impaired ability to perform motor activities despite intact motor function is known as blank. A. Agnosia. B. Aphasia. C. Apraxia. D. None of the above. The correct answer is C. Apraxia. 79. Which of the following is not true about Alzheimer's disease treatment? A. There are different cures for Alzheimer's disease. B. Drugs can be used to treat Alzheimer's disease. C. Antipsychotic agents such as haloperidol and risperidol can be used as drug therapy. D. Memory training may aid patients during certain stages of Alzheimer's disease. The correct answer is A. There are different cures for Alzheimer's disease. 80. Blank is also called vascular dementia. A. Alzheimer's disease. B. Multi-infarct dementia. C. Hyperabic dementia. D. None of the above. The correct answer is B. Multi-infarct dementia. 81. Which of the following is true about vascular dementia? A. Vascular dementia typically starts between age 60 and 75. B. It accounts for an estimated 10 to 20% of dementias. C. It affects more men than women. D. All of the above. The correct answer is D. All of the above. 82. All of the following are true about vascular dementia except A. The conditions tend to progress in stages. B. A sign of vascular dementia is depression. C. Diabetes is a contributing factor of vascular dementia. D. Approximately 50% of patients have both vascular dementia and Alzheimer's disease. The correct answer is D. Approximately 50% of patients have both vascular dementia and Alzheimer's disease.